the spinal injury severity scoring. Still, I will try the way Dr. Amro told to present the case. Let's see how this one is this one. Okay. So we have this case of a patient, a 21-year-old Saudi male who arrived with a left arm pain, nose bleeding, essentially multiple trauma on the last day of May. And patient had a fracture right surgical neck of humerus, fracture mid-shaft left humerus, and maxillary fracture, and received chest tube because he developed already left hemothorax. And comminuted fracture L2, L4. Interestingly, L3 was preserved absolutely intact with patent posterior neural arches, and preliminary score of severity score, injury severity score for thoracolumbar spine was 2 without any neurosurgical deficit or severe low back pain. So the TLSO brace was applied as soon as it was available. Not immediately, it takes a little time to get it. But patient was doing neurologically all through normal. And CT brain was also normal. CT brain we did because he had a loss of consciousness momentarily. So, okay, the second day, the CT scan revealed complex unstable L4 involving both the anterior and posterior column and right facet joint with retropulse segment in the spinal canal. I'll show you shortly. And elective, the first decision was elective transpedicular fixation after canal decompression. Initially, we thought we have actually a spine injury team and comprising of orthopedic surgeons and neurosurgeons. And but on 2nd of June, the score we found that it is maximum 2, not even 3. And which does not warrant surgical intervention immediately. And there was, as you know, that he had other multiple fractures for which he also needed, the other surgeons were asking me if you want to do immediately or if you want to do it later, then we can proceed. So I said that, okay, you proceed and we'll wait. And because patient was neurologically intact, totally intact, there was no deficit. So goals are now to control pain, and I planned for the MRI. And the family was informed, but MRI we could not do because the other surgeons implanted some incompatible MRI incompatible devices, so MRI was not available. And the progress note, as you see here, that to see the patient can tolerate sitting straight, then our plan was to have the dynamic X-ray to see if there is any movement, and if there was any motion, then our plan was to fix the instability. As long as the patient does not develop any deficit and the brace keep the spinal column stable, then my decision was that we can still buy time, and waiting for 3 months will be that was the plan, and we explained to the patient. But essentially there was no we are not on the same ground. Our orthopedic surgeons were in favor of doing the intervention, and I said that no, as the patient does not have any, and I followed actually that thoracolumbar scoring and yeah, coming. Yeah, I did not prepare the same way as I said. Okay. So unfortunately, this patient, the delay, the reason of delay of decision making also the patient suddenly developed, as you see, the melena, and due to a stress ulcer, and hemodynamically stabilization also. So months of, it took really long time to intervene surgically, but that was not the plan until we find that there is any instability. And here I explained the causes why there was a difference between decision. And here we see that dynamic X-ray could be done at last on after at least more than a month, and we saw that there is no motion. And on lastly, we decided that with the TLSO brace, we will go home and we'll bring for every month for a study of dynamic studies. So then let's go to the films. Okay. So as you see here on the left, this CT scan shows the L2 fracture. This and after just yesterday we did the one after he was not being.
Where's the initial X-ray? ED was 31st of May.
Yes, 31st of May, I definitely will bring some here. Okay. This is the 31st May. This is the first X-ray, and that was 2 weeks before, which you can compare. So as you see here, here is the first X-ray on 31st May. And the fracture here, as you see, and number 2 and number 4 and number 3 intact. And this actually we did just 2 weeks before. And as as it is not, also this is initial the 3D reconstruction. Now this is the latest one. We had this in between. So I actually compared that with this, following this method of conservative treatment, which patient all through remained intact. There was no neurological deficit, and they had no back pain. And even yesterday's examination was same. That patient, his father gave him a new car because he's involved in a car, and he's back in work and everything. So my intention, as I said before, was to discuss with you about this. Also, I talked with Dr. Kim this morning when that if he will be here, so that we can discuss more of the biomechanical things, that how you can say that how this type I did not see, that third lumbar vertebra intact and second involved and fourth involved. So I asked him that, what do you think the mechanism of injury? He said that this can happen due to the impact, axial rotation like that. And so now my intention, as I said, that should we treat these patients surgically, or should we wait until we see any motion in the dynamic X-rays? There's a dynamic X-rays. We did 3 series, always it was intact. And Dr. Amro also knows about this case, because we discussed about the case during this. Is he here, Dr. Amro? Habib, no. Anyway, so he also with me that yes, this patient immediately does not need any surgical intervention unless we see any motion in these dynamic films. And he's only 21-year-old. And another reason was the delay in decision was, as I said, that until we see any motion, we'll not do. And of course, he developed a lot of complications after different surgeries. So when after 3 months we saw that there is no motion, so we stay in the same decision that we'll go for conservative treatment. So I think now you can ask me questions or give your opinion that should we do the surgery outright. In the first case, let me show you the first X-ray. Yeah, here. So this was the
so
day
you elect to treat this patient conservatively, and you succeed in achieving healing and preserving the segments. Now we will open the floor for discussion. Anyone will go from the beginning for surgical intervention?
I think for this conservative, it has been dictated. It was not a choice, because the patient was unstable and he get to through multiple